Hi, my name is Melissa Lawford. I'm a massage therapist at Meridian Ab Massage and Spa. I specialize in deep tissue and treatment massage. Well, with deep tissue, it's using deeper pressure, getting into the deeper layers of the muscles and unwinding the fascia. Most patients that I end up treating are ones that are from car accidents, some kind of injury, could be a sports injury, post-cervical of some degree as well, or is just going to the gym and overworking their body and they're having pain and stiffness and it's deeper into the muscle tissue and it needs to be worked out. I've been a therapist for 15 years. Well, this has been my passion for 15 years, but it actually came to me. I was a corporate manager at a different company, and then one day it just hit me that that is not what I was meant to do, and that is not what I was supposed to be doing. So I took a paid vacation that I had, and then during that paid vacation, massage therapy and going to college, for this just felt perfectly into my lap in a meant-to-be situation, and I just knew. So I jumped and I did it, and it was one of the best decisions I've ever made. Well, anything really, but most patients who come in, they're having signs of like limited range of motion, like you go to move and it's very restricted, or you feel a pull or a deep pain, or if you've been injured to any degree of sports or auto accident, like I said, or we're working at the gym, or you fell and you had an accident, or you're just having overall like constant pain, getting in here, getting on the table, getting a massage, letting us release those muscles and release the tightness that's pulling on your bones and your joints is going to help you feel better overall. Well, first of all, you want to make sure that they're Washington State licensed and they're actually legit through Washington State or whatever state that you're in. You want to make sure that they're licensed. But the second one is you want to make sure they're knowledgeable. Like when you're coming in for a purpose, you want to be able to see a therapist who's going to actually be able to listen, understand, and have the knowledge to be able to address your body in the right way, to actually give you a massage that's going to be more beneficial for you than not beneficial for you. So even with that, you're also looking at their personality. Is it somebody who compliments you, that you feel a good energy with? Are they accommodating you the way that you need to be accommodated? Are they making you feel safe and comfortable? Are they saying, let's have open communication? If I'm doing something you don't like, let me know so I can fix it. Or if you're not comfortable with this, or the pressure is too much for that, or I'm working an area that you don't want to be worked on, you need to be able to have this space of the massage room to be comfortable and safe and confident while you're on the table. So as a massage therapist, we're here for that. So you want to be able to not just feel comfortable and safe and have the therapist be knowledgeable about everything, but you want to be able to be with a massage therapist that you're actually feeling comfortable and a connection with. So then that way your guys' relationship going forward is actually going to be a good one for both of you. Well, it actually came to me, like I said previously, in a meant-to-be situation. And as a kid, I guess I just always was the caring one out of everybody. And it just made, it came to me in a meant-to-be situation, and school and college and everything just kind of clicked. And I just knew this is what I was meant to be. The most important quality, knowledge is one. Being able to be teachable. This isn't a cookie cutter kind of job at all. You're going to be learning stuff and you're going to have curveballs thrown at you all the time. So you need to be able to adjust and be able to learn something new that you didn't know, whatever the means of learning that may be. So knowledge, flexibility, understanding, all of those are going to be really good things in a massage therapist and good qualities for a therapist to have. My favorite part of the job is the initial eval when I'm actually seeing a patient and seeing what's going on with them, getting to know them through the progress of our plan. And then my biggest one is afterwards the results. I've worked with a lot of amazing patients in the past that came to me at their worst point of their life. And with massage therapy and other treatments, going back to work, being able to rock, play with their kids. I've worked with a lot of breast cancer patients and just honestly seeing their good spirits and getting them back to a better place and knowing that I had a hand in that and helped that. What's greater than that, really? There just isn't anything greater than that. The most challenging part of my job is working with a patient who wants to get better but doesn't do anything themselves. So with deep tissue and treatment, a lot of it is, here's a plan that we have, a treatment plan. It has different steps. It's going to go up and down. But what I do here at my job will help you, but you're going to have homework and stuff that you have to do at home to kind of help keep that progress going. And the most difficult thing is working with a patient who wants to get better but doesn't do any of the homework stuff at home. So they themselves are not doing anything to kind of help. But then they come in and they're like, well, you told me that you were going to get better, but I'm not seeing improvement. And it's kind of like, well, I kind of also told you that you had homework to do and you're telling me you're not doing it. So we're kind of a team and we both need to be doing what we're doing to kind of help get some progress. So I think if you start doing stuff at home and do a couple of suggestions that I'm giving you, give it a week or two, and then you're probably going to see some progression. But that also means that you have to be included in the team of helping me as well by doing your homework. My favorite type of massage to give is the deep tissue and treatment. I like to break down the muscles in a healthy way and then rebuild them in a healthy way. I feel like for me, that just comes naturally, and that's what I love because I feel most patients will get the most benefit and the biggest progression of whatever issue that they have going on, having the muscles actually focused on and worked on. I'm kind of a lightweight because I do a lot of massage for many years. So I like treatment work, but I need a lighter pressure instead of a deep tissue. I do a lot of variety stuff, and I think every massage therapist should actually be doing this. We have our Washington state or whatever state continued education that's required. That's broken down, the hours are, so we have that variety there. But for me, I research and I watch videos. If I'm seeing a patient and they're coming in and telling me something that's going on with them that I don't know, I go, you know what, I don't know that, but explain it to me. I'll get the GIFs and then I'm going to research what you just told me. May it be watching a YouTube video. May it be Google searching it. May it be networking and talking to other therapists and go, hey, this is a patient that I'm working with. Are you familiar with this? Can you fill me in? Can you give me any suggestions that you have found worked in the past that I don't know? Or sometimes I have all my textbooks from college. I go to my textbooks, I research it, and I break it all down. So that way the next time my patient comes and sees me again, I can say, you know what? I didn't know, but this is all that I found. And this is what is kind of recommendation for good results, or these are kind of like, I don't know, let's try it out and do a process of elimination and see, does this help you or does this not help you? Because just because it helped one patient doesn't mean it's going to help another patient. And so I just use as much stuff that I can get my hands on to be able to stay up to date and always learning and always being taught something new. The biggest things that I would consider is making sure this is something for you. If it makes sense and it clicks, then you're meant to be a therapist. If you're having problems not understanding or having a lot of confusion or you feel really off about it, unfortunately, you're probably not going to be a massage therapist. This is kind of a career of something you either are or you're not. It's not a career or profession for everybody. But also when you go into it, make sure that you're teachable, right? Because you're always learning something new. You're going to be working with a lot of different people, not just your patients, but your coworkers, and whatever environment that you're going to be in has its own things. So you constantly have to be open and understanding to be able to learn and be taught something new. Also, have your own knowledge. Have your own base of knowledge of everything that you want, what you gravitate towards. Be very knowledgeable in that, but also know that you're going to be seeing a wide range of patients with different needs. So you want to have a good basis of knowledge of everything as much as possible. But that's where the teachable comes in when you don't know something. You're going to be reaching out to people, researching it and everything. And palpation. Palpation is the touch, the feeling. Make sure that your skills on that are very, very efficient and very good and very strong. Because as a massage therapist, when I'm working on somebody's body, my hands are my eyes and my ears. They let me see and tell me where I need to go. And that's all by palpation, by feeling a person's body with their fascia, their muscle fibers, the muscle belly, the tendons, the ligaments, the bones. If you're able to zone in and get your palpation skills really strong, you can do a massage and literally let your hands and the patient's body direct and tell you exactly where to go and what needs to be done just by your palpation skills. So those would be my top ones.